Okay, so we'll be starting with today's topic, that is hepatobiliary disease. So, before going into the topic, let's see what the basic structure of liver is and why this basic structure is important. You will get to know soon. Okay, so let's have a quick brush up on the anatomy of liver. So, whatever useful part is there, that only I'll be discussing over here. Okay, so I hope that all of us know what is liver, right? Now, let's see what is the shape. We know it's a wedge shaped organ, isn't it? So this is the beautiful organ, the largest organ of the body. The name is liver, isn't it? It is divided into two lobes, the right lobe and the left lobe. We know that the right lobe is again divided into two, the caudate lobe and the quadrate lobe, isn't it? So we have two lobes over here in the right part or the right lobe of the liver. Now this screen is not visible. I guess there might be some issue. Please check with like, I guess it's visible to rest of the people. Please let me know. Am I audible and visible to all of you? Please give me thumbs up. Okay, okay, okay. Isha, please check your settings. Maybe some issue is there. Okay, so this is the organ, the liver, and it is divided into two parts, that is the right lobe and the left lobe of the liver. And we know that the right lobe of the liver is actually six times greater than the left lobe. So this is the right lobe and this is the left lobe of the liver. Okay, now this partition of the liver, the basically these two parts, the right and the left lobe, are divided by a ligament. Actually, it's not a single ligament but three ligaments dividing the lobe, isn't it? What are these ligaments? Let's have a look over here. These are falciform ligament, ligamentum venosum, and another one is ligamentum teres. Okay, so these are the three ligaments that divides the right and the left lobe of the liver. As well as this liver is covered by a thin capsule. That capsule is called what? That is the Glissen's capsule. Glissen's capsule, isn't it? All of us know this thing, that it is Glissen's capsule. Okay, so this is the basic rough anatomy, that what liver is like. It's a wedge shaped organ and it has two lobes, the right lobe and the left lobe. The right lobe is greater than the left lobe, and the right lobe is again divided into two parts. What are those two parts? It is the quadrate and the caudate lobe. Okay, so the quadrate is inferior and this caudate is what? It is posteriorly present. Okay, so I hope that this part is clear. Now, after like before sorry, after this, what we'll discuss is that what is what is the blood supply of the liver. Okay, what all, how the blood is getting supplied in the liver. So we know that liver is a special organ and it is collecting blood through many of the organs, and then pouring that blood into the vena cava, and then through that vena cava the blood is getting into the heart and then circulated, isn't it? So let's see a rough view of the supply of the blood of liver, because this will help you further to understand that whether these congestions of different organs happen, different diseases, it's like splenomegaly is there in a certain, in other ascites and all happens. Why that thing happens, it will be clear once we know the blood supply of liver. Okay, so we know that what kind of blood supply is there. It has dual blood supply. Dual blood supply, isn't it? Liver has dual blood supply. Now what is that? Let's see. So again, this is the liver. Okay, then this, let's make a GI tract over here. So this is the GI tract. Okay. Now over here, liver receives one hepatic artery. Okay, it receives one hepatic artery and one portal vein, isn't it? It receives one portal vein. Then what else goes out of the liver? One central vein goes out, or hepatic vein goes out of the liver, and bile duct goes out of the liver. I hope that this is clear what it is. What all it is, I'll just write it down. Just give me a second, I'll write it down. So, this is hepatic artery. Hepatic artery. This is our portal vein, which is giving blood into the liver. So you can see that there are two pathways through which the blood is coming and two pathways through which the blood is going away, isn't it? So this is bile duct, and the another one is the what? It is hepatic vein. Okay, so this is the complete circulation of the this liver. So hepatic artery comes, then bile duct goes away, portal vein is pouring, and hepatic vein is going away. So I hope that this basic blood supply, like all of us know the basic blood supply of liver. Okay, now what happens? Among the four, the three are the best friends. Among the four, the three are the best friends. Who are the best friends? Among these, the except the hepatic vein, or hepatic vein is also called as what? It is also called as central vein, isn't it? Central vein. So except the hepatic vein or the central vein, we have three people over here who are the best friends. So who are these best friends? So portal vein, bile duct, and the hepatic artery. These three are the best friends. They always travel together from the beginning to the end. Even the branches, the small branches also travels together. Why I am saying so? I'll show in the next slide. See, now let's suppose, yeah, all of us know that, let's suppose that this is the liver, isn't it? Over here, what we have over here, we have hilum of the liver, isn't it? In the hilum of the liver, what is okay, over here what we have a gallbladder, isn't it? And from here we can say that a bile duct passes in, isn't it? And similarly, we have the hepatic artery passing the blood, and what else? A portal vein over here. Okay, so these three are the supplies which we know it's there. Okay, now over here, although they seems to be over here, we can see that they seems to be what? Together. Similarly, they are together inside. Let's suppose the small branches are there, no, inside. Now inside, what will happen? This will get divided further. Then the hepatic artery will also get divided. All of them will get divided inside, isn't it? So even their branches will be running together. Even their branches will be running together. So here you can see again they three are together. So every time the branches will be seen together. And where you will see this, what these three are combining and forming? Yes, can anyone tell me what these three will combine and form? Yes, if they are traveling together, what these three will combine and form? Yes, can anyone? What these three will combine and form? They will form the portal triad. Yes, that's correct. They will form the portal triad. Okay, because all the threes are going together. Okay, so let's see the detailed structure of the liver again. Now we'll be seeing the hepatic, basically, yeah, the histopathology, the histology part. Okay, so we know that this is the liver. This is the liver. isn't it? Now, if we go into the detail, we know there are hepatocytes. Hepatocytes, hexagonal hepatocytes. Let's zoom in and we know there are hexagonal hepatocytes. These are the hexagonal hepatocytes, isn't it? So we here we have hexagonal hepatocytes. Now, these hepatocytes have have what? The central vein, the central vein. Okay, so here we from here we can understand that where it is in the the central vein will be in the center, the hepatic vein, and it will only combine and form the hepatic vein further. Okay, and at the periphery we have the portal triads. At the periphery we have what? We have the portal triads, isn't it? So these are the portal triads over here. Now, when we will zoom in, now in this portal triad, who all will be there? Definitely the bile duct will be there. Definitely the hepatic artery will be there. Definitely the portal vein will be there in each of them, isn't it? Now let's zoom in one of the hepatocyte and see what all is happening over there. I hope that this structure is clear, that where all the things are there. So I'll just write it down. This is the central vein, and this is what? These are the hepatocytes. These are the hepatocytes, and this is the portal triad. This is the portal triad. Okay, now let's move forward and we will check, we'll see that how the structures are actually present and how they are working. Okay, so what we said, we have a hepatocyte. Okay, we have a hexagonal, we have a hexagonal hepatocyte over here, and we have a central vein over here. Now we know what is there. What is there? We have a portal triad over here, which has what? It has a hepatic artery, it has a branch of portal vein, it has a branch of bile duct. So these three things are present in the portal triad, whereas this is the central vein. Now in between the portal triad and the central vein, what all is present? The hepatocytes are aligned. The hepatocytes are aligned. We can see this. The hepatocytes are aligned in this manner. What we call it? What we call this arrangement? This arrangement of hepatocyte is called as what? Yes, can anyone tell me what these arrangement of hepatocyte is called? It is called as trabecular adjustments. Okay, so trabecular, basically a trabecula is formed. A trabecula is formed. Okay, now in between these trabeculas, what is present? What is present? There are bile ducts present over here. Bile ducts in between, yes, bile ductules, basically bile ductules are present, or canaliculi can be also called. Okay, so these are the canaliculi present over here. Now what we can see is that as each cell, as each hepatocyte will make what? They will make bile. The cells will form bile, and this bile will be transferred in this manner, and all of these will combine and then form a what? A common bile duct further. Common common bile duct further. Okay, so I hope that this thing is clear, that how the bile is forming in the cell and how it is getting secreted out. Okay, so this thing is there. Now the another part of the hepatocyte, let's zoom it, see. Now what will happen inside? We know that the capillaries are there, isn't it? These are the capillaries. These are the capillaries present inside. Capillaries present inside the thing. Now what who made these capillaries? The hepatic artery has only made these capillaries. Okay, now in between the capillaries, these are what? These are the endothelial cells. Okay, these are the endothelial cells. Now I hope that this much is clear. Now we can go and see a detailed structure of this part. I'll just show which part. we'll be seeing a detailed structure of a zoomed structure, a zoomed, yes. Mm. This part, we'll be seeing a zoomed structure of this part further. So let's see what is that. So let's suppose that these are the hepatocytes. We'll just make the hepatocytes over here. Huh. So these are the hepatocytes. Okay, again. Okay, so these are the hepatocytes. Now, over here, what will be present? The capillaries will be present. So these are the capillaries. Okay, the endothelial cells basically. Okay, now in between the endothelial cells, we have a macrophagic cell in the liver. What it is? It is the Kupffer cell. It is the Kupffer cell. Okay, Kupffer cells. These are what? Macrophagic cells present in the hepatocytes. Okay, another cells that we have which has a very important role in the disorders of liver, that cell is called as a stellate cell, or it is also called as Ito cells. Stellate cells or Ito cells. So this cell, this particular cell, this is this is Ito cells. Ito cells present in the liver. I hope that the hepatocyte, I hope that this is clear. And the space left over here, the space left over here, this particular space is called the what it is called? Yes, anybody knows that? What this space is called? This space is called space of Dissay. Space of Dissay. Space of Dissay where these Ito cells are present. Okay, so this is the histology part of this complete hepatocyte. Now, why I have gone through this complete histology? Why we went through this? Let's see why we did that. So we have to think about the Ito cells over here. Actually, we'll be discussing about the Ito cells over here. What are these Ito cells and what they are doing? Okay, so as I said that these Ito cells, this Ito cell is doing what? Now, what happens normally in normal physiological condition, when there won't be any kind of pathology involved in the normal condition, what will happen is that this Ito cell will be normally this Ito cell will be storing fat or vitamin A or vitamin D. Okay. So this Ito cell will be storing fat normally or vitamin A or vitamin D. Whereas if any injury happens to the liver through any reason, it can be alcohol, it can be a food item, it can be any allergen, it can be a physical trauma, anything, any injury when happens, then what will happen? This Ito cell will get converted into myofibroblast. myofibroblast. Now, what is myofibroblast? The term clearly says that it will be forming fibers. Basically, the collagens are formed. The collagens are formed, and these collagens are fibrous, and then the liver cirrhosis happens. What happens? Liver cirrhosis, because these collagen will form, and these fibers will be forming what? Fibers will be there. Then these fibers start converting and form a shape where they are holding on the other part of the this fibroblast, and they start repeatedly forming nodules, and then that nodular part does what? It destroys the cells of the hepatocyte and forms, and what happens? Cirrhosis of liver happens. Okay, so this was the basic idea about the eto cells and its function. Okay, I hope that this is clear. Now the thing is, we will seeing the another part. We'll be seeing the zones of the liver. What are the zones of liver? Why we are saying about the zones of liver, or why we are interested in zones of liver? So let's see that. So zones of liver, basically it is the zones of the hepatocyte. Okay, so why we are dealing about this thing, why we are dealing with it? So let's suppose this is our hepatocyte. Okay, again, now we know this is the central vein. Now the part which is near the central vein is the zone 3 area. Then we have a zone 2 area. Then we have a zone 1 area. Okay, so what is it? What is it? Zone 1. Okay, so 3 2 1. This area is 3, this is 2, and this is 1. Now why it is important? Let's see. Whenever a necrosis in the liver are classified as zonal necrosis. Zonal necrosis. Now, what does that mean? It means that the necrosis, the death of the cell, occurs according to different zones. Okay, now what are these and how it is? Let's see that in the next slide. So, over here, we'll see. Let's suppose that let's suppose let now what happens whenever there will be any ischemic condition, then what will happen? Which part of the this hepatocyte, or the yes, which part of the hepatocyte will be affected, or which zone will be affected? It will be the zone 3. It will be the zone 3. Now can anyone tell me why it will happen? Why during ischemia the zone 3 of the hepatocyte will be affected more? Mostly what, it's like it will be only affected, but not zone 2 or zone 1. Why? Can anyone answer? It's definitely due to the central vein, but why? Why due to the central vein? Yes, why? It's definitely due to the central vein. It's correct, but why? What is the role of the central vein over there? Why? Actually, the exact reason is okay. See, what happens is, we know that this central vein is away from the hepatic artery, isn't it? And the fresh oxygenated blood is where? Over here. We have the fresh oxygenated blood over here, whereas the central vein is taking what? The deoxygenated blood, isn't it? So this zone, the zone 3 is actually away from the hepatic artery. Because of what? Because of that, what happens? The oxygen level, we can say, is reduced at the zone 3. The oxygen level is reduced at the zone 3, and therefore all the ischemic diseases, all the ischemic condition, if occurs, they will affect the zone 3, and the zone 3 area of the hepatocyte will be affected. Now what are the diseases that will affect the diseases will be such as cardiac, either shock or cardiac failure, or it can be chloroform toxicity, or halothane, or it can be any viral hepatitis. Any viral hepatitis. Okay. Okay, I hope that it's clear. That so now why we are learning that zone 3 of the area is affected, what we have to do with the zone. So while diagnosis, you will go through the reports, and there you will get to know, and then you can have an idea that what the condition may be, and it has been seen in the histology that this part is affected. Okay, now what about zone 2 and zone 1? So the zone 2 will be is affected only in yellow fever. Yellow fever, whereas zone affected, sorry, zone 1 is affected during either eclampsia, eclampsia or phosphorus poisoning. Eclampsia or phosphorus poisoning. Now, what is eclampsia? It is hypertension during pregnancy. It is hypertension during pregnancy. Okay, so I hope that this zonal necrosis is clear. The damaging is clear. Okay, now we before moving towards liver cirrhosis, we will discuss one topic, that is chronic venous congestion. What we will learn? We will learn chronic venous congestion. What is chronic venous congestion? Let's see. CVC. What is that? Chronic venous conjunction. Sorry, congestion, not conjunction. Okay, I'll just write it down. It is chronic venous congestion. Okay, now let's see what it is. It is very interesting thing. Okay, now we know what we know that we have a liver over here. Let's make a liver. Okay, then we have lungs. Okay, we do have lungs. Okay, we have a heart. Of course, we have a heart. Okay, now the thing is, we know that there will be portal artery going towards the lung, and oh, sorry, yes, from the right it will be going, and over here the superior vena cava and the portal vein will be giving this to the superior or inferior vena cava. This is the portal vein, and this is what? This is the right side of the heart and left side of the heart. So here you can see one thing. Here you can see one thing. What is it? That let's suppose that a person goes through a right sided heart failure. A person goes through right side heart failure. Then what will happen? What will happen if there is a right side heart failure? This will stop working, right? So what will happen? The blood won't be able to go directly into the lungs, isn't it? Then what will happen? Then from the ventricles it will go into the aorta. From the aorta it will go where? Into the veins or vena cava, and from there where it will go? Into the liver, isn't it? So what will happen when this backflow of blood will happen? Then what will happen? Then definitely the lodging of blood will be there, and because of this lodging of blood, what will happen? The organs which are supplied by this portal vein will be affected. Okay, I hope that it's clear. And what all things will be seen? Congestion will be seen in all of those organs which are connected to this vein. Okay, so what are the organs that will be affected? So it is liver, it will be spleen, and of course other mesenteric part will be also affected. In case if you're not familiar with it, don't worry. like I'll be discussing it in detail in liver cirrhosis when we'll start liver cirrhosis. Okay, so I hope that chronic venous congestion is clear. What is happening? We know that the blood will be supplied by the heart to the lungs through the pulmonary artery, and if in case a person is having a right heart failure, right side heart failure, then what will happen? This blood won't go into the lungs, then definitely it has to go somewhere, because it has to be moving, isn't it? If it's not moving, we can't imagine a stagnant blood over there, isn't it? So it has to move, so it will move. So what it will do, it will move from ventricles into the aorta, then from aorta, that basically the backflow of the blood will be there. And once there will be backflow of the blood, what will happen? Definitely the organs will be congested. Okay, so what all organs will be congested? If you have a good overview of anatomy of the blood supply of the portal vein and where all the blood is going in the organs, then definitely you will understand it very well that what all organs will be affected. Okay, so I guess how much Okay, so I guess I can stop this session over here and I'll start a new session so that we can start liver cirrhosis, a fresh topic, because it will end in between if I start that. Okay, so this whole lecture was all about the introduction of hepatobiliary disease and a small brief of anatomy of liver and how the cells are arranged and why this cells arrangement was important. You will get to know when we'll study the liver cirrhosis. So this anatomy and this basically histology of the liver is very very important in case to know the diseases well. Okay, so I'll be starting a new session. Meet you there.